Bone marrow embolism is almost wholly a pulmonary phenomenon, as only in quite exceptional circumstances can a cellular material penetrate the lung capillaries. Though again the frequency with which it is seen is directly related to both awareness and the thoroughness of the search. Bone marrow embolism within the pulmonary arteries are first observed in animal experiment and man by Lubarch and his pupil Lenben, and almost simultaneously and independently by Maxino in traumatic experience with the rabbit. In addition to traumatic death with the bone fractures, bone marrow embolism has to be observed in cases of post-convulsive death due to tetanus, eclampsia, eclampsia, convulsive shock therapy, electrocution, therapeutic or investigative procedures such as a thoracotomy, sternal puncture, cardiac massage, or traumatic death as in blast injury. It is quite common in association with the fractures of long bones or in a multiple bone injury, and may or may not be associated with the multiple bone without a fat embolism. The common occurrence of fat and cellular embolism is strong evidence of marrow source of embolic fat is pointed out by Mason, who found marrow cells in 81% of his cases that had a grade 2 or more lung overloading with the fat on a scale of 0 to 4. According to both Sevitt and Mason, the finding of both substantial fat and marrow embolism in the lung is definitive evidence of antemortem infliction of any discovered trauma. For these elements to reach the lungs, there must be competent circulation, at least for a short time after the trauma, with the possible exception of burns. Any injury inflicted after cessation of effective death cardiac function cannot be transmitted fat or marrow to the pulmonary capillary bed. This is therefore useful forensic marker of some occasions, such as differentiating between antemortem and postmortem fractures in a body recovered from water. Systematic embolism is not seen in rapid death following trauma. There is an interval of averaging 24 hours before lung percolation takes place. Okay. You can differentiate between antemortem and postmortem. There is healing, calyx will be there, bone resorption, bone, soft tissues damage. But in postmortem fractures, lack of healing, no inflammation, limited surface soft tissue damage, don't bother. This is the pulmonary bone marrow embolism, that is fat vessels is there. This is a blood vessel. Thank you.